Hello everyone. Today, we're delving into the world of a medication called diazepam, commonly known by its brand name, Valium. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Diazepam, often recognized by its brand name Valium, is an oral medication belonging to the benzodiazepine class. Its primary function is to act as a central nervous system depressant, exerting anxiolytic, sedative, muscle relaxant, and anticonvulsant properties. Initially approved by the FDA in 1963, diazepam is commonly prescribed for the management of anxiety disorders, muscle spasms, alcohol withdrawal symptoms, and as an adjunctive treatment for seizures. Additionally, it's utilized in preoperative settings to alleviate anxiety and induce sedation. Diazepam works by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, leading to a calming effect on the nervous system. It's available in various forms, including tablets, oral solutions, injections, and rectal gels, providing flexibility in administration based on individual needs. Warnings: Diazepam comes with its set of precautions. It's essential to use it cautiously, especially in individuals with a history of substance abuse, as it carries the potential for misuse, dependence, and addiction. Long-term use should be avoided due to the risk of tolerance and withdrawal symptoms upon abrupt discontinuation. Diazepam is contraindicated in patients with severe respiratory insufficiency, sleep apnea, acute narrow-angle glaucoma, and myasthenia gravis. Additionally, it's not recommended during pregnancy, particularly in the first trimester, as it may increase the risk of congenital abnormalities. Breastfeeding mothers should also avoid diazepam due to its potential to pass into breast milk and cause sedation in infants. Before taking this medicine. Before starting diazepam, several factors need consideration. It's crucial to inform your healthcare provider about any allergies, especially to benzodiazepines or similar medications. Individuals with a history of liver disease, kidney disease, respiratory disorders, or a substance use disorder should exercise caution and discuss potential risks with their doctor. Diazepam may interact with other medications, including other benzodiazepines, opioids, antidepressants, antipsychotics, and certain anticonvulsants, highlighting the importance of disclosing all current medications to your healthcare provider. Additionally, alcohol consumption should be avoided while taking diazepam, as it can potentiate its sedative effects and increase the risk of respiratory depression. Side effects: Like all medications, diazepam can cause side effects, which may include drowsiness, dizziness, blurred vision, headache, dry mouth, nausea, constipation, and changes in appetite. Some individuals may experience paradoxical reactions such as increased anxiety, agitation, or hallucinations. Long-term use of diazepam may lead to cognitive impairment, memory problems, and a higher risk of falls, particularly in older adults. Serious side effects such as respiratory depression, severe allergic reactions, and paradoxical excitement require immediate medical attention. Prolonged use or abrupt discontinuation of diazepam may result in withdrawal symptoms, including rebound anxiety, insomnia, tremors, and seizures, necessitating gradual tapering under medical supervision to mitigate withdrawal effects. Interactions: Diazepam may interact with a wide range of medications, supplements, and herbal products, leading to adverse effects or reduced efficacy. It's essential to inform your doctor about all current medications, including prescription drugs, over-the-counter products, vitamins, and herbal supplements, to prevent potential interactions. Concurrent use of diazepam with other central nervous system depressants, such as alcohol, opioids, antipsychotics, and sedative hypnotics, can potentiate sedation and respiratory depression, posing a significant risk of overdose. Conversely, certain medications, such as rifampin, may accelerate diazepam metabolism, reducing its effectiveness and necessitating dose adjustments. Dosage: Correct dosage is crucial for the safe and effective use of diazepam. Always adhere to your doctor's recommendations and dosing instructions. The appropriate dosage varies depending on the indication, severity of symptoms, individual response to treatment, and concurrent medications. For the management of anxiety disorders, the usual starting dose for adults is 2 to 10 mg, taken 2 to 4 times daily. For muscle spasms, the initial dose is typically 2 to 10 mg, 3 to 4 times daily. In the treatment of acute alcohol withdrawal, higher doses may be required initially, followed by gradual tapering to prevent withdrawal symptoms. The dosage for preoperative sedation ranges from 5 to 20 milligrams, administered 1 to 2 hours before the procedure. Dosage adjustments may be necessary in elderly patients and those with liver or kidney impairment to minimize the risk of adverse effects. It's important to follow your doctor's guidance regarding dosage adjustments and not to exceed the prescribed amount. Avoid. While taking diazepam, it's advisable to avoid activities requiring mental alertness and coordination, such as driving or operating heavy machinery, due to the potential for drowsiness and impairment. Alcohol consumption should be avoided to prevent additive sedative effects and increased risk of respiratory depression. Long-term use of diazepam should be avoided whenever possible, as it may lead to tolerance, dependence, and withdrawal symptoms upon discontinuation. If you have concerns about your medication regimen or experience any adverse effects, consult your healthcare provider for guidance and appropriate management. FAQ. Many individuals inquire about the duration of treatment with diazepam. The duration of therapy varies depending on the indication, severity of symptoms, and individual response to treatment. Diazepam is generally prescribed for short-term use due to the risk of tolerance, dependence, and withdrawal symptoms associated with prolonged use. It's essential to follow your doctor's recommendations regarding the duration of treatment and to undergo regular monitoring to assess the need for continuation or discontinuation of therapy. Closing. That concludes our overview of diazepam. Remember, this information is provided for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for personalized recommendations and guidance regarding your treatment plan. Thank you for joining us today.